Welcome back. So, really quickly, I want to talk about the last little bit of vital signs, which are pulse ox and pain. Now, these were not included in your book, but these are very, very important ones that you may be performing on a daily basis as a CNA. So, pulse ox and pain are often referred to as either the fifth or the sixth vital sign, depending on which one you use. And these are both indicators of the well being of a resident or indicators of disease or disability. So, pulse ox is a way to check the oxygen saturation or the oxygen level in your blood, and it also reads your pulse. So, this is a painless, quick procedure that uses a light to read the oxygen level through the skin. You put the little pulse ox on the person's finger, on the end of their finger, and there's a red light that shows up through it. And you put the red light on the pad of their finger, and then it'll read. And sometimes it takes a minute to get going, and then you'll see. Kind of look at that picture on the side, you'll see the little green bar. It'll go up and down with the pulse. So you'll get a pulse ox reading, which is the oxygen, and then you'll also get a pulse. So this is a good indicator of respiratory and circulatory status because this is an indicator of how well the oxygen is getting out to all of the tissues. And the fingers are going to be one of the furthest things away from the heart. So you'll see whether or not all the oxygen is able to get out everywhere that it needs to go. So you can put it onto the resident's finger. Sometimes you can put it on their toe. You can put it on their ear, and then some of them actually tape to the nose. And having nail polish on the finger may inhibit the function and give an inaccurate reading. So if you've got a lady with nail polish on and she's getting kind of a funky reading, see if you can get it on somewhere else. So poor circulation or cold skin may also give a low reading, so you may need to warm up the person's hands or move to a different body part. So if they do have poor circulation, their hands are really cold, they're a little bluish tinged, you really don't think that you're going to get a good pulse ox, or you're getting some kind of really, really poor reading, you may need to help warm up their hands or maybe stick it on their ear. So a normal pulse ox reading is going to be either at 90 or 92 and above. I say 90 or 92 depending on the facility. Now there are some different conditions that will cause the pulse ox to be different and maybe a little bit lower in some people, but we'll get into that whenever we get into the different disease processes and our physical changes that accompany aging. So it's documented or recorded in percentage, and you need to document whether or not the person is using supplemental oxygen and how much. So if you get a pulse ox reading of 94 and the person does not use any oxygen, then we would chart it as 94% RA or room air. And then if somebody had 2 liters of oxygen going, then it would be 95% 2 liters O2. So that would indicate that person does have a little bit of supplemental oxygen going. And that's really important because there's a reason why the person's on oxygen in the first place. So you need to check to see how well that oxygen's working and indicate that they're on it. Sometimes you may be asked to do a pulse ox with the oxygen and one without, and that's okay. So you wait just a couple minutes without the oxygen on, or maybe a minute, and then put the pulse ox on, get a reading, then put it back on, wait another minute, get another reading. So that's something you can do. So pain is another indicator of disease or disability in the body. Now some residents are going to have chronic pain issues, and that means that they're in pain all the time due to various factors. Some people with degenerative disc disease, where they've got all of their discs in their back are deteriorating, or people with cancer, or people sometimes with heart failure have pain. So you cannot assess for pain but may screen for it. So what this means is that it's not your job to figure out why the person's having pain and what to do about it, but you can find out if they're having pain and report the pain and the location to the nurse. So if somebody tells you, "Oh, I'm having pain in my stomach," that's all you need to know, and report that on to the nurse. So it's going to be the nurse's job to figure out what's going on with this person to cause that pain and what do we need to do about it. So some facilities may use different pain scales, and I included a pain scale on the next slide, and we'll kind of talk about that one. Now, keep in mind that some residents, such as those with dementia, may not be able to express pain. So they may start having unexpected, unwanted, what we call negative behaviors, um, trying to pull at things, trying to hit people, getting really kind of angry. They may be in pain. So when we get to talking about dementia in Unit 21, we'll go really in depth in that, but just a kind of FYI for you ahead of time, almost all of our behaviors with dementia are some unmet need, whether it's physical or emotional, and pain is a big one. So if you see somebody getting kind of angry, kind of hitting out, they're just not in a good mood, they're grimacing, then that can be an indicator that they're in pain and we need to do something about it. So you may be able to assist with pain relief by either repositioning, doing back rubs, giving somebody a bath, whatever the case is. But the resident may require either medication or medical intervention to relieve the pain. So just because there is something you can do, that does not mean that you don't have to report it to the nurse. So absolutely report to that nurse. If you've got a resident that says, "Oh, my back's really sore, it's been sore for a couple days, I'm not sure what's going on," then you can report it to the nurse and see, "Hey, do you think maybe a back rub would help? Can I do that?" Or get him a hot pad or something. So definitely report it to your nurse and see what they want you to do. And always check your care plan, because there may be interventions, especially for those in chronic pain, as to what they need to have done for them. And kind of going back to the pulse ox as well, check the care plan to see what the person's pulse ox level needs to be. So they may have, the doctor may say, "Well, I want them at 92 or above all the time." Well, if they're at 90, we need to do something about that. So just kind of keep that in mind. As with everything else, check the care plan, see what's care plan for them. So this is a universal pain assessment tool. So this pain scale I picked because this not only has the 0 to 10 scale, but also a description of what their face might look like. So you can ask people, or generally the nurse, it's up to the nurse to ask them, "Well, okay, you're having your pain in your stomach. What is it on a scale of 0 to 10? 0 being no pain, 10 being the worst pain you've ever felt in your life." Not a lot of elderly people are going to be able to answer that. Some people will, but some people might look at you like you're crazy, and they just say, "Well, I'm hurting, that's all I know." So then you can look at their face. Are they pretty happy? Are they in a little bit of mild pain? They're starting to feel it. Moderate? They're starting to feel a little bit more. Maybe they're not walking around as much, or they're having more trouble getting on and off the toilet when they're in moderate pain. Then when they get into the severe pain, then it's going to interfere with their concentration. They're going to be thinking about that pain all the time. It's going to start interfering with their basic needs. They're not going to want to even go into the bathroom because they're hurting so bad. And then if they get to that absolute severe pain, where you're at a 9 or a 10, they may have to stay in bed. Hopefully not. Hopefully we can get it cut off as soon as possible. So with these pain scales, the one thing I'll say is it's best to get intervention taken care of as soon as possible, because some people might be, at a 3 or 4, and they think, "Oh, well, I can tolerate it." And a lot of older people are going to say that. They're going to say, "Well, I'm kind of hurting, but it's no big deal. I'll be all right." And they'll kind of try to play it off. But if we get that intervention in place ahead of time at a 3 or 4, that's going to prevent us from getting to a 9 or 10. And the higher you get on that pain scale, the harder it is to relieve the pain with whatever intervention you're doing. So that's all I have to talk about with pain scales and pulse oxes. And if you have any questions, please ask your instructor, and we'll kind of talk about this a little bit more at Skills Lab. Have a wonderful day.